this report looked at about 182 studies of people who had high blood pressure to see what kinds of stress management and relaxation techniques might work to lower blood pressure. And they found that most of the ones they looked at actually were beneficial in the short term, less than 3 months, at lowering both the top number of your blood pressure and the bottom. The bottom lowered by about 3 to 5 points, and the top one by about 7 to 10 points. So, for example, breathing and music lowered the top number 7 points, meditation 8 points, mindfulness, Tai Chi, and yoga, and even psychotherapy by 10 points. So all this proving that mind-body connection that we know is so real.
And you're a cardiologist, so besides blood pressure, how is stress harmful to our cardiovascular system?
It is such a pervasive and under-discussed risk factor for cardiovascular disease. When you go to the doctor, Michael, I'm sure they ask you, do you exercise, do you smoke, but how often do you get asked about your stress level? So I ask all my patients, of course they say, well, I live in New York City, it's always high, right? But we know that stress is bad, but how is it bad? So it activates a pathway where the brain then tells our body to release hormones like adrenaline and cortisol. This causes inflammation, changes in our blood vessels, raises our blood pressure and heart rate. All of that can lead to heart attacks, strokes, sudden death, and heart rhythm problems. You know, our stress response evolved for us to deal with acute stress, like running away from a lion in the wild and then turn it off. But unfortunately, in this day and age, we turn it on all the time chronically for things like, am I going to make my mortgage payment? What's happening with my kid at school? Will I make this deadline? And that can be damaging. So all these techniques we just talked about are really good at changing how we perceive stress, how we react to stress. And that's what I tell my patients. Look, you can't change the stressors. You can change how you respond, and you can turn off or dial down that response periodically throughout the day.
All right, Doc, thank you. That is some great advice.